Hey, what's up, everybody? It is Sunday, probably 77, approximately 12 days post-surgery. Everything's going well. Just got a little patch of Band-Aid down here. It's still quite swollen though, and I think some blood has found its way through. Overall, everything's much better. It just seems like time has passed so fast this past 12 days, probably due to the fact that I was heavily medicated. Spent a lot of time by myself. Had some good friends come over, help me out with a lot of things, cook food, bring me some food, take me here and there, because for a limited time I was, obviously I'm not going to drive under the influence of pain meds and whatever else I was taking. It's been very nice, actually, to see that friends actually there to help out and take care of the things that I needed to take care of. So it's Sunday night, just eating some food and trying to eat clean, trying to get some food back in. I've lost a considerable amount of weight. I mean, other people say, oh, you look fine, you look great this way, but to me, I'm small. So what we're eating tonight is just some tilapia, some spinach, and rice. And just trying to get my meals back in. I had a shake this morning. So probably roughly around like 3 weeks post-surgery, I'll start doing some cardio. Light cardio, because once the blood pressure goes up, they say this is why that's why the blood starts coming out. And being in this sport, first of all, is tough enough as it is, and I tell a lot of people, when they first talk to me, and I'll continue to talk about it, is to try to live a normal life while you're competing. Try to accept yourself at different stages of the year, because this is the hardest part for many people to deal with, is looking a certain way for a show, and then the film of water starts going over your body, and you're starting to soften up, and then people still want to continue to keep that condition, but obviously you can't. You got to let yourself go. The faster you learn that, okay, it's time to shift and let your body actually go back to a normal state, faster you will actually be able to move on with life and stop being so obsessive about getting back into the gym and I got to do my cardio. At one point in my career, it was 1999 when I went to California State. All I did was eat, sleep, train, and I didn't have to work because I was making money on the side, just doing some personal part-time training here and there, and I had my website up at the time, and I pretty much had a house anyway, so there wasn't a lot of bills. So going back to 99 when I went to Cal, all I did was, like I said, eat, sleep, train, eat, sleep, train. I focused so hard on that show, I really didn't socialize, I didn't do anything. And it was weird. After winning the show and winning the overall, I sat here like I am sitting now, but it was at another house. And I was like, shit, what do I do with myself now? I usually have a schedule. I gotta get up, do cardio, then eat, and then maybe have a client, and then eat, and then go train. And I was doing double sessions then and doing double cardio. So that was my routine every day. It was just a weird feeling that, what do I do with my time? And it was just like, that was the first time that anything has ever happened to me like that. And then I go out with some friends, and it's the first time I've been out in it was probably 4 months. So we go to a club, and I'm sitting at the club, and I looked at my friend, and I said, shit, I don't even know how to pick up a girl. I said, what the hell do I say? He's like, come on, man, you're the Persian missile. What I try to tell people, after you're done with a show, or even while you're getting ready for a show, you always got to have something that's like a little bit consistent in your life, something normal. You know, have some sort of job that you're around people, because, you know, if you're just in the gym constantly all the time and you're not socializing with people, there's not going to be a way for you to like really be social when you're supposed to be in a situation that, like, say at expos or seminars or whatever. It's going to be very awkward for you. And then the mindset that a lot of girls get into is that they start freaking out. Oh my God, I gained 10 pounds. Well, you know, honestly, that 10 pounds probably looks better on you and it's more healthy than you being in contest shape. And I think women have the hardest time with this, is that they get down to a certain weight and they look so good, especially women who have done like major transformations. And they look at themselves in the mirror and then they see that scale and it really messes with their head. And I try to tell them, I said, the faster you understand that you can't be in this contest mode and you cannot stay that lean, it's not healthy for you, the faster you'll be okay with yourself and you'll like let this like mindset go. And okay, so here's 3 months, I got ready, I looked perfect, in great shape. Now after this, I slowly let my weight go up, but only to a certain point, and I start going back to normal life, normal eating, maybe a little bit more food, more healthier foods, because for a woman and their hormone levels, it's definitely very much more important than, you know, for, you know, even a guy needs it, but, you know, it's not healthy to stay that lean all the time. I've dealt with so many women that are come to me, and whoever else has been training them or helping them with their diet, put them on so much supplementation or whatever the case is. I don't want to get into the certain names and words, but, you know, they screw up their thyroid, they screw up their estrogen levels, and they're a complete mess. And, you know, they want to get on this program to get in shape for another show, but their body's fucked up. It's already so screwed up that they shouldn't even be thinking about doing another show. They should be thinking about normalizing their body. But you see, that's what happens to a lot of people who get sucked up into this and who are not strong, who don't listen to people with experience. I've been doing this for 20 years. I've been through all the ups and downs. Everything you can think I've been through, I've been through. I've had depressions after shows. I've had depression before getting ready for a show. Nobody knew any of this. And this is the first time me kind of speaking about it. I talked about it with some other friends of mine, and openly, I think on maybe a chat board or a radio talk show at one time. But not too many people want to come forward, because a lot of bodybuilders and a lot of other people actually go through this, because our hormone levels, when we're getting ready for a show, we'll be honest here, we're fucking Superman. We're Wonder Woman, okay? And we all know why we are. People say you can't make improvements. That's what you're going to see here, okay? That a surgery, a disc replacement, 41 years old, people say, you know, oh, too old to make improvements. Well, honestly, I didn't know my neck was messed up like this for the past 5-6 years, you know? And progressively it was getting worse, so that's why I wasn't making improvements. I wasn't able to make improvements in my chest. People were always saying, oh, your chest, your chest, your chest. I look back at my pictures, my chest was thick. My back was very good. My rear delts were very good. My triceps were thick, you know? But progressively, when my neck got worse, I also atrophied in these areas. So I really had to sit back and say, you know what? And I didn't do this. I was stubborn myself. I didn't know how severe this was. Probably 3 years ago, you know, my chiropractor told me, we did an MRI, he said, your neck is a little pinched, 4 millimeters here, 6 millimeters there. But it wasn't an extensive MRI like we did this last year, to show how pinched off the nerves were and how messed up this disc was. This last year really did it in for me, and it was the worst pain I've ever had. So I was like, you know what, if I want to continue with this, I have to go get a surgery. And just imagine being able to go to the gym for so many years and train, and now I'm sitting here, I can't do anything for 4 weeks, 5 weeks probably. And then when I do go back, talking about starting over, I'm going to probably have to do like maybe a quarter of the weight I do for everything in the beginning for the first week. And then second week go up slowly, third week go up slowly. So, you know, if I can get through this, and we'll see progressively how it goes, and come back to be on stage, then a broken arm or different things people can come back from. So that's what you'll get out of this. Peace out.